Hello, everyone, and welcome to Heads Up, the official weekly podcast of the National Headache Foundation. This is Dr. Lindsay Weitzel. I'm a migraine strategist. I am the founder of the Facebook group Migraine Nation, and I'm a chronic daily migraine survivor. I am here each week with Dr. Vincent Martin, MD. He is the director of the Headache and Facial Pain Center at the University of Cincinnati, and he is also the president of the National Headache Foundation. Thanks for being with us tonight. Hi, Dr. Martin. How are you doing?
Doing great today.
We have a great topic today. Today, we are going to talk about status migrainosus. Status migrainosus is when we have a migraine for 72 hours or longer. A lot of us end up going to the ER for these types of migraines. So we're going to learn all about them tonight. So my first question is, let's just define status migrainosus. Does the pain always last 72 hours, or is it still status migrainosus if, let's say, we have 2 days of pain and then we have a third day of vomiting or another aura symptom?
No, it's technically just the pain episode itself. So if you have 72 hours of a migraine that has pain, because prior to and after the migraine, there can be migraine symptoms. So it's part of something called the prodrome, which can precede the migraine by days. You can get sensitivity to light, noise, and nausea. And there's something called the postdrome, where you can get similar type symptoms and intense fatigue and so forth. So if you don't want to include those as well. So it's really just involves a headache, a migraine headache that lasts for 72 or more hours.
Okay. So another question I have is, when a person is experiencing status migrainosus, does it stay the same or does it change at all? Does it change locations? Does it get better or worse during the 72 hours?
Well, the migraine can vary. Sometimes it can stay in the same place, or oftentimes it will move. Like early in a migraine, it might be in the left temple, and then it might go off to the right temple and then involve the entire head. So there's a variety of different manifestations of the headache that we would call status migrainosus.
Okay, so it doesn't have to sit right here for 72 hours for us to call it status migrainosus.
No, but usually all the symptoms are worse. They tend to have, nausea tends to be worse, the sensitivity to light and noise tends to be worse. I think their ability to tolerate the headache becomes less, and that's understandable because you can imagine if you've had the severe pain or moderate to severe pain of a migraine going for close to 72 hours, that emotionally you can be really frazzled at that point.
Yes, this is true. So what are some possible reasons that status migrainosus occurs?
There could be a number of different reasons. First of all, it may relate to the migraine trigger. So for example, in women that have something called menstrual migraine, which are migraines that occur 2 days before to 2 days after menstruation, the trigger is both a low and falling estrogen level in particular, and there may be other hormones as well. But that trigger can be persistent for several days. So we know that menstrual migraine actually is a headache that has a longer duration. So it's very possible that may be the time period where women would be more prone to status migrainosus if you have these hormonally triggered headaches. Another example would be weather. So let's say that you're sensitive to a low pressure system. And let's say that low pressure system comes in and then it just kind of stays there for 2 or 3 days.
Right.
So all of a sudden during those 2 or 3 days, you just feel like, horrible.
Yes.
During that time, you've got a migraine, the trigger persists, and then all of a sudden when it rolls out of that area, all of a sudden your headache gets better.
Yes.
So it could relate to the trigger. But the other thing that it could relate to is the brain. So we know that as people get more frequent headaches, they're more likely to get more severe and disabling headaches. So your nerve cells might just be hypersensitized. They're just in a state of constant activation. So it doesn't take much for them to activate and then not turn off. So it could either be a problem with your trigger, or it could be a problem with your brain. Or I guess a third possibility would be maybe you're just not responding particularly well to your abortive meds.
Right.
You have inadequate abortive meds. You can't get rid of the attack early, which is when you're going to respond best to your medications. and all of a sudden the headache persists for longer durations of time.
Mm-hmm. I can definitely relate to the weather one. That happens to me a lot in the spring, for sure. Is there anything we can do to avoid status migrainosus? Obviously, we can avoid certain triggers. What else can we do?
Well, I think the big thing is to try to get your headaches under control. So
Mm-hmm.
if you've got this hypersensitive nervous system,
Right.
then you want to take migraine preventatives to try to help that. So you may want to see a doctor or health provider that can get you on the right meds. You
Mm-hmm.
might want to practice behavioral techniques like relaxation techniques if you're anxious or stress bothers you. You may want to exercise. You may want to eat an appropriate diet. You may
Mm-hmm.
want to eat regular meals and avoid fasting. You want to get to sleep about the same time, every day, and wake up about the same time every day. So you
Right.
want to practice healthy neurologic lifestyles. So you want to do everything you possibly can to tame down that overactive nervous system to
Mm-hmm.
prevent episodes like status migrainosus.
Right. What are some of the things that have been shown to be effective in breaking a status migrainosus cycle?
Well, there are no trials, at least that I'm aware of, that have looked at this per se, or at least not many. But we often will use steroids.
Mm-hmm.
A number of studies in the ER, and many people who present with status migrainosus, some of them will end up in the ER, but they've done studies of patients with migraine where they'll give them steroids, and they find that steroids tend to decrease the duration of headaches. So if you're someone with status migrainosus, that's exactly what you want. You want the duration of the migraine decreased. So oftentimes we'll give steroids for varying periods of time, anywhere from 6 to 12 days in my experience. And you have to also use the right dosage as well, although they're not great studies looking at steroids. Now, if that would be something that you could do at home. Other things would be that you might need to get intravenous medications.
Mm-hmm.
And that could be done either through an infusion unit. Those are basically situations where doctors have access to a unit that can give intravenous medication. So intravenous means medications by vein.
Right.
And different cocktails that we can give and bring people in for anywhere from 1 to 3 days to try to break the cycle. And then finally, there's the emergency room. So if you don't have access to an infusion unit or other therapies at home, then you might need to go to the ER. And the reason why someone would go to the ER might be that their therapies at home are just not working and they're in extreme pain. They could be getting dehydrated because they're vomiting and they may need intravenous fluids.
Mm-hmm.
Or they just, ultimately emotionally they just can't handle it anymore.
Yes.
It's
It's
just
emotionally exhausting. Yeah.
overwhelming, and you just need something to get rid of it. Or maybe they've got an event the next day and they've got to break it right now.
Yes.
So there could be a
Yeah.
number of reasons why that would push someone to go to the emergency room.
I can relate to all that. It's physically exhausting, it's emotionally exhausting, and there are things we have to do. So yeah, you touched a little bit on my next question. I wanted to ask if status migrainosus can be managed at home. What are the best things to put together for those of us that want to break it at home?
Well, the first thing is to have a migraine toolkit. So if you're prone to these long duration headaches, you need to have therapies that match the severity of the headache. And usually there's certain therapies that tend to be more effective than others.
Right.
Like, for example, there's something called ketorolac or Toradol, and that can be given either in a pill form or injectable. And sometimes what we will do is we'll give it intramuscular shots of Toradol, and patients will learn how to give those at home. So you basically would have another therapy that could be used. If you're using triptans, ones that involve shots, like they can be given what's called subcutaneously right underneath the skin, tend to be not only more effective for migraine, but they can be used if people are vomiting too. So you might want to consider having either a shot of, say, sumatriptan, or there's nasal sprays that could be used as well. And those tend to be a little bit more effective and they work a little bit faster than, say, just tablets alone. So what you really want to do is have like a migraine toolkit at home to manage these situations. So you might have your a pill form of a triptan. It's like an Imitrex-like med. But then you might also want to have the shot, or you might have a shot of Toradol at home. Or if you and your doctor talk about it, maybe you could give your doctor a call and they could give you steroids in situations that, where you could take those at home and maybe prevent either a trip into the infusion unit or a trip into the ER.
Great. Okay, is there anything else you'd like to add on our topic of status migrainosus?
I don't think so. I think we covered it.
Okay, well, I can say that it is one of the most physically, mentally, and emotionally, exhausting things. And it is okay if you think you can't take it anymore and you need to go to the ER, and I have been there. So here's Dr. Weitzel and Dr. Vincent Martin signing out on Heads Up for this week, and we will see you next week. Bye-bye.